Pericardiocentesis is the procedure used to remove fluid from around the heart that's within the pericardial sac. The tools you'll need for pericardiocentesis include a larger sized syringe, a long 14 gauge catheter, an extension set, a 3-way stopcock, and collection tubes, including a purple top for cytologic analysis and a red top for possible culture. You then are going to find your landmarks. The best way to find the pericardial sac is to take the patient that is in sternal recumbency, and they're usually sedated, and you're going to pull the arm back to the chest cavity, and where the elbow hits the chest is the approximate site of the heart and pericardium. You're then going to shave a squared area and prepare the site aseptically. At this point, some people will use local anesthetic, so a small amount of lidocaine in the skin area. And you can either take a blade and make a little nick incision in the skin for advancement of the catheter, or you can just pick up the skin, put the needle through the skin, and then feel where your intercostal space is before slowly advancing the catheter into the chest cavity and into the pericardium. So you're going to slowly advance at a right angle to the patient until you see fluid filling the hub of the catheter. Once you see fluid filling the hub of the catheter, you advance another ½ inch or so, and then you're going to take the needle out and you're going to connect your extension set to the catheter. The extension set is then connected to your syringe. And again, having someone else suction the fluid while you're holding onto the catheter is the most efficient way to remove the fluid. Once your syringe fills, you turn the stopcock off to the patient, and you're going to fill your tubes with the fluid sample and then empty the rest of the syringe into a bowl or a graduated cylinder. Then you open back up to the patient and continue aspirating until you get negative pressure. One thing to remember is that this catheter is in the pericardial sac, and you can irritate the myocardium during this procedure, and so your patient should always be connected to an EKG so you can verify if there's any arrhythmias. And if you do start seeing arrhythmias, it's recommended that you pull the catheter out and start over.